tennis elbow, or what's called lateral epicondylitis. It's basically that the outside area here on your humerus, where the muscles that go down to control all the muscles in your hand and your wrist, where that starts to pull the tendon away from the bone a little bit. That causes extreme pain, where a patient will notice the pain is right in this area. It'll be very, very tender, and they might have problems, grasping things. It might cause very severe pain there, picking up a book, all sorts of things. So they can get it from hammering, from playing tennis. You may never have played tennis in your life and still have tennis elbow. So anyways, definitely something that we can help with in the office, but it's very important that you take an active role in your care to speed up your recovery and also to make your recovery lasting. So in the medical first level and the first stage of rehab, what we're going to have you do is just rest the arm and the treatments that we're doing in the office to help it heal. An ice pack, fantastic. A gel pack, taking and just putting that over that region after the treatment, and also when we're doing exercises, anytime we are doing those exercises, making sure that you are icing afterwards to reduce the inflammation that has been created. You could wrap an ACE bandage around this and just keep that there for about 10 to 15 minutes. These usually don't get too cold, but if you want, you can put a layer of paper towels between the ice and your arm. So we would do that maybe a couple times a day for 15 minutes. And then also using something like a tennis elbow strap, the one that we carry in the office and we recommend because it seems to be the best from our research, is called the Bandit. And the reason we like it is that instead of putting a continuous pressure all the way around the forearm here, which blocks blood and nerve flow, blood very important for healing of this area, it only is going to push down over these muscles, your forearm flexors and extensor muscles, just there, leaving the areas on either side where the blood and nerve flow go unobstructed and not compressed. And what we do with this is we'll have her put her arm through there, and then we get this where it is about 2 or 3 inches from the elbow joint down. It needs to be over the muscle portion here. So when you feel your arm here and you have a squishy part, and then on the sides it'll feel like you can touch the bone kind of, you want to be on the muscular portion there. So just like that. I'm going to tighten this down just a bit. Your hand shouldn't be turning white or blue or red. And it should just provide a little bit of support there. Whenever you're doing anything that would cause pain here, know that that is re-injuring the area. So a strap like this can really help speed up healing because you're not re-injuring it during the day as you're doing your daily activities. The goal is not to have you wear this for the rest of your life. This is just during the rehab phase to make it so that you're not re-injuring yourself. Excellent device. First stage of exercises we're going to do here is gentle stretching. So the first thing we're going to have you do is bring your hand out like this, and we're going to stretch the muscles on the opposite side. You're kind of pulling your fingers back, and where you should feel the stretch is right in here, right? We want to make sure that the elbow is extended. We don't want the elbow bent because you won't get as good a stretch. So the elbow needs to be extended, and then we're doing the stretch. We'd hold this stretch for about 30 seconds, just a gentle stretch, and then we're going to do the opposite. We're going to bring your hand over this way. Perfect. Again, the elbow is extended, and we should feel the stretch on the top there. If this causes intense pain, you're not ready for this stage yet. We need to ice more and help it heal more. These muscles get very tight with typing, mousing, all the stuff that we do on a daily basis. Pulling back here, again, the elbow is extended, and you're going to feel the stretch in this region. You're going to hold your fingers back, just like this, and then we'll have you do the other one. Again, you would hold that for about 30 seconds. We'll have you do the other one where you're bending this way. Elbow is extended, bending at the wrist. We should feel a stretch here in this area. The next thing we're going to do is help to strengthen those muscles. But the way that we do these exercises is the most important part. So I'm taking a very small weight here, a 3-pound weight. We're going to start with, you could use a soup can. So what we're going to do here is she's going to take and bring her elbow down on her thigh like this. And she's going to take and do extension of the wrist very, very slowly. Okay? If I was doing it here, fully going down and then fully coming back up. The most important thing is that we are slowly letting it back down, right? it isn't so much how fast we come up, but we want to let back down very slowly. Maybe down to a count of 3. You might notice that you're a little ratchety with it on the way back down. That just shows that these have lost their control to decelerate any movements, and that's a prime reason that people get hurt in that area. So very important for us to work this. And again, the deceleration phase, the most important. Then we'll have her flip her forearm over. Perfect. Again, resting it on the knee. Her wrist is right there at the end of her knee so that it allows it to hinge there, but it's not hanging over too much, like this. So right back here. And then she's going to go down, good, and then bring it back up as far as you can up. And then again, slowly releasing it back down. You might notice that it's a little shakier. Usually people are stronger with their wrist flexors than they are their wrist extensors, and that's why we see more people with tennis elbow or lateral epicondylitis than golfer's elbow. We're looking that her arm is resting on her thigh and hinged here. We'll actually have her pull this out just a little bit and then bring it down as far as you can. Good. And up as far as you can. Good. Again, being very, very slow when we return it back down. Sometimes you'll notice a little shaky. A 2 to 3 pound weight, a great size weight, and then to slowly increase that as you work up to that. If this is causing a lot of pain, we need to go back to the stretches. This is a gradiated rehab program, and so the first thing is the icing. The next thing that you will get to is the stretching. And then after that, we're going to get to this and one other exercise I'm going to show you with the rubber band. Okay, we'll have you flip your arm over. The next part of the exercises for tennis elbow that we're going to work on, you can also use this for medial epicondylitis or golfer's elbow, is working the finger extensor muscles. When you think about it, we're constantly grabbing things in this world, but we're very infrequently opening our fingers against any load. So what you're going to do is take this fancy piece of rehab equipment. This is not a thin rubber band, but a little bit bigger one. I would not use the ones that come on like a broccoli stock grouping. So this rubber band here, you can stretch it a bit, and then you're just going to put it over the tips of your fingers. It's harder than it looks. Put it over the tips of your fingers, and then we're just going to extend and close in. Extend and close in. Again, coming back to neutral very, very slowly. Like this. And then when we're done with that, any of the exercise sessions, we're always going to want to be using the ice, the gel pad or the gel pack of ice there to reduce any inflammation that we've created by working out those muscles. It's very important as you are rehabbing for tennis elbow that you're not going out and doing any exercises that are causing significant pain at this area. So if I go back and I want to start tennis, I'm kind of ripping those fibers away from the bone before they've had a chance to heal. That will significantly impact your ability to heal, and it can mean that the condition goes on for months or years. So in the healing phase and the rehab phase, we want to focus on these very controlled motions, very controlled activities, and not be too hasty to get back to our sport, which can cause delayed healing.